The Department of Health is committed to reducing the deaths of children under the age of 5 by 2/3 by 2015. Almost 1 in 5 of the children who die before their 5th birthday die within a week of their birth. Many of these deaths are caused because the babies are born with low birth weight and are too tiny to survive. Special care is needed for these babies, and one of the best ways to ensure their survival without incubators is through Kangaroo Care.
I started Kangaroo Mother Care at Kalafong in 1999. It was the first unit in Gauteng. Kangaroo Mother Care is the special way of tying a baby between the mother's breast, skin to skin. And this is important because the mother needs to keep the baby warm, so she mustn't have any clothes on. So usually the baby is only dressed in a nappy. If a baby is placed skin to skin and placed on the mother's chest, they will heat much sooner than being placed in an incubator. So you don't need incubators, you just need mothers that are healthy and warm and that can heat their babies.
Jane Mashiko, a 28-year-old Atteridgeville mother, gave birth to premature twins at Kalafong Hospital. As part of postnatal care, Jane was introduced to kangaroo mothering, and since then, the twins have shown remarkable growth.
I was introduced to kangaroo mothering in 2009 when I had my first child, who was also a premature, born at 2.5 kg. My twins came at 36 weeks, first twin weighing 2.5 and the second twin weighing 1.5. KMC helped me to take care of my babies in so many ways. It helped with their growth, it helped with me bonding with them, it helped with feeding, how they are supposed to be fed, because as they were born early, I needed to know the importance of breast milk and the importance of kangarooing and the logic behind it.
Preterm birth is the world's largest killer of babies, causing more than 1 million deaths each year. In South Africa, more than 8 out of 100 babies are premature.
Premature birth means that the baby was born too early. Early meaning that usually a baby, the normal gestational time that the baby spent inside the womb is 40 weeks or about 9 months. So if a baby is born before 37 weeks, then the baby is classified as preterm. Then preterm can also be classified even further, very early preterm or late preterm. Late preterm is, for instance, from 34 weeks to about 37 weeks. And then if a baby is born around 37 to 38 weeks, we say early term, and then a baby is term when he's born about 40 to 41 weeks. So there are lots of classifications that we use, and the reason why we do this is that it gives prognosis. Babies that are born early term and preterm have more risks of developing problems, like for instance not sucking well, becoming jaundiced, having low blood sugar and so on. Then low birth weight babies, any baby that is born, even if he's term, so even if he was 40 weeks gestation and he weighs less than 2.5 kilos, we call them low birth weight babies. And these babies also are prone to having problems. And so these babies are then also cared for in the kangaroo position.
Sister Eva has dedicated her life to giving care to premature babies and their mothers at Kalafong Hospital for 30 years of her 40 years as a nurse.
I'm working with premature babies. I have 2 patients, meaning it's the baby and the mother that I'm taking care of. Kangaroo Mother Care is unique because here the mother is the primary care of the baby. The healthcare workers are just assisting the mother by showing her what she's supposed to do, but the mother is the one who's bathing the baby. The mother is the one who's warming the baby as he's keeping the baby between the breast. The mother is the one who's feeding the baby. So the mother is the sole caregiver to this baby.
The other component of Kangaroo Mother Care is the nutrition. And the nutrition is, we advise breastfeeding, because breastfeeding is the best food that a baby can have, but especially a premature or a low birth weight baby, because babies that are prematurely born can develop a condition which we call necrotizing enterocolitis. And what that is an infection of the intestines, where the intestines becomes like big sores, and this kills babies. And if a baby is on breastfeeding, they don't develop this problem. The breast milk also has antibodies against infection. And what is also wonderful is that the mother has the baby here. If the baby has been colonized with some bacteria that has come onto the baby, then it also comes onto the mother. The mother's got a good immune system. She makes antibodies, and specific antibodies that protects the baby against those bacteria. So via Kangaroo Mother Care, less babies get infection, and if they do get an infection, it's not as severe.
Kangaroo Mother Care is one of the methods that is used towards reaching the Millennium Development Goal of reducing child mortality rates.
The other component of Kangaroo Mother Care is a Kangaroo Mother Care discharge. So when a baby is ready for discharge, and there are different criteria, we look at criteria for the baby as well as for the mother. If the mother is ready and knows how to practice Kangaroo Mother Care, she's comfortable with the baby and so forth, and the baby is gaining weight, taking breast milk well, sucking nicely from the breast, and over a certain weight, the baby will be discharged home. But this baby needs to carry on with Kangaroo Mother Care. So this is then Kangaroo Mother Care that is practiced at home by the mother and must be supported by the family. And so the three main components then is position, nutrition, and discharge. And overall, surrounding it is the support that the mother needs to practice and do Kangaroo Mother Care. And the support is given firstly by the nurses and the medical staff and allies, and then secondly, it's given by the family and the people living around the mother, the community. So everybody must know about this practice, and they must support the mother to do Kangaroo Mother Care at home. And then the babies will thrive. And part of the early discharge is also follow-up. We send these babies home very soon, so we must make sure that they are thriving at home and that they are doing well. So we have a clinic where we follow up the babies. We weigh them, we measure them, their length and their head circumference. We plot them on percentiles, on graphs to see that they are growing well, and we give advice if we pick up that there are problems. So that is the practice of Kangaroo Mother Care.
I still use KMC at home, especially with a second twin, because it's still a bit small, but with a big twin it's a bit impossible to kanga both of them at the same time. So I'd say I'm using it for the small one.